Welcome to Samaritan Health Services. Our mission is to provide you with holistic and comprehensive cancer care. Our team of skilled physicians, nurse practitioners, and oncology nurses have extensive experience and training in radiation and medical oncology, as well as hematology and internal medicine. Our oncology nurses will provide you and your family with clear instructions, pertinent information related to your care, and assist with any questions or concerns that you may have. In addition, our support services are always available to assist you with your needs. Some of these support services include nutrition counseling, social and psychological services, financial assistance, and other educational resources. We understand that this can be a difficult time for both you and your family, and we will be there with you every step of the way.
Hello, I'm Shar.
And I'm Martha.
We're both registered nurses that work at one of the Samaritan Infusion Centers, and today we're going to talk about some things about chemotherapy you may need to know.
In addition to this video presentation, you will receive a patient guide to cancer care. The guide is meant to be an in-depth manual for information related to cancer treatment and chemotherapy and other cancer treatments. The guide contains highly detailed information, so we will refer back to that several times during the presentation.
Most people have heard the term chemotherapy, so let's talk about what it means. Chemotherapy is the word we use to describe the medicines used to treat cancer. Most of the time we just call it chemo. There are many different kinds of chemo drugs. Whether you receive one kind or several kinds, which ones and how often will all depend upon the type of cancer you have, its extent in your body, its location, and how the cancer is affecting you. Chemotherapy is given for different reasons. Sometimes the goal of chemotherapy and other cancer treatments such as radiation and surgery is to cure the cancer. Sometimes these treatments are given to keep the cancer from spreading or to slow its growth. In other words, even though some cancer cannot yet be cured, we use chemotherapy to try to keep it in check. In the event that cancer growth cannot be stopped, chemotherapy may still be given to relieve the symptoms caused by that cancer growth. By now, we hope you have talked with your oncology provider or nurse practitioner who's prescribing your chemotherapy about your particular type of cancer and how chemotherapy may benefit you. Oncology providers and patients sometimes have different ideas about what the treatment goals are. So if you not yet had this opportunity to talk with your provider, we encourage you to do so. Understanding your cancer diagnosis and treatment options will help you and your care providers decide upon a plan of care that is right for you. Before we go any further, let's have you pause and grab pen and paper or your patient guide in case you want to take notes. That's the beauty of video. You can pause, rewind, stop, and review at any time.
Now let's talk a bit about how chemotherapy works. All of the normal cells in your body go through stages in their life cycles. They divide, they rest, they have work to do, and when they're no longer functioning properly, they die. Cancer cells have changed so much, they no longer have these normal life cycle patterns. Cancer cells tend to have this rapid, disorganized division and replication, and even though they're not functioning normally anymore, they don't die like a normal cell would. This rapid division of cancer cells leads to tumor formation, tumor growth, and spread. Cells which are undergoing rapid division, however, like cancer cells, are vulnerable to chemotherapy because chemo damages cells as they divide. However, there are tissues in the body where it's normal for cells to divide rapidly, so some normal cells may also be damaged. For this reason, your chemotherapy plan is designed to highly expose the cancer cells to chemo, but also provide rest periods for your normal cells to recover. This period of receiving chemotherapy followed by a period of rest is called a cycle. A chemotherapy cycle may contain one or more types of chemo, one or more doses of medicine, and may involve several days. The timing of your cycles is very important and was specifically planned for maximum benefit for your type of cancer. Effective chemo will begin to target cells and kill them when it's given. During the rest period, when your healthy cells are recovering, the cancer may also begin to rally. But before the cancer returns to its previous level, we hit it with chemo again. And so in this way, we hope to see a downward trend in the cancer growth. This illustrates the importance of getting your chemo on time every time. Occasionally, it is necessary to delay chemo treatment, usually to resolve an intolerable side effect, like a low blood count or severe diarrhea, for example. Later on, we're going to discuss common side effects. Also, your patient guide contains information on how to manage them. Dealing appropriately with chemo side effects is one of the ways to keep your treatment schedule on track and keep you as comfortable as possible.
Now let's talk about how chemotherapy is given. Some chemotherapy preparations are given by mouth as a pill. However, if you're receiving your treatment at a hospital, clinic, or infusion center, it is likely you're receiving intravenous chemotherapy. The word intravenous means inside the vein. The most common way of giving intravenous treatment is by inserting a small plastic tube called an IV cannula or catheter into a vein of your hand or your arm. Another way of giving treatment is through a PICC line. A PICC line is inserted in your upper arm and can be left in place for up to 1 year. Some patients have what's called a port. A port is a small mechanical device about the size of a quarter that's inserted just under the skin of your chest or upper arm. A port must be placed by a surgeon, but once inserted, it can remain in place for the duration of your treatment. There are other types of lines that are sometimes used. Your nurse can give you detailed information about these if they are appropriate for you. Regardless of the method, once your chemotherapy infusion begins, it should not hurt. In fact, if you feel any stinging, burning, coolness, or numbness in the area of your IV, you should let your nurse know immediately. You may notice more than one nurse conferring over your medication before giving it to you. For your safety, our facilities require that all doses and names of chemotherapy be verified by more than one nursing professional. Additionally, you will be asked to state your name and birthday before receiving any medication. Again, this is for your safety. Your nurse will likely wear protective clothing such as a gown and gloves when hanging your chemotherapy, and this is for the safety of the nurse. During the 48 hours after your chemotherapy treatment, the medicines you receive will be metabolized and excreted from your body. During this time, there may be small amounts of chemo present in your body fluids, such as urine, vomitus, or stool. In order to protect yourself and your family members from unnecessary exposure to these chemicals, please take precautions if handling any of these types of body fluids becomes necessary. Care should be taken when toileting that all urine goes directly into the toilet bowl and is flushed promptly with the lid down. If you have pets or small children, please make sure they don't have access to the toilet bowl during this time. If you should have a body fluid spill, such as vomit, gloves should be worn to clean the area and remove the contaminated linens and clothing. These then should be laundered separately with an extra rinse. Chemo drugs are not passed through the skin, so bodily contact such as hugging and touching is safe.
Infusion centers schedule their patients according to orders received from the oncology provider. You always need an appointment to receive chemotherapy and should make every effort to keep your appointments and be on time. If you need to be late or miss an appointment, please call the infusion center as soon as possible. If you feel that you must miss an appointment because of illness, pain, or other cancer or treatment-related problems, please ask to speak to a nurse when you call. You may be having a side effect or toxicity from your treatment that requires medical attention, and we'll help you sort this out.
Your family and friends are always welcome at Samaritan Health Infusion Centers. Space is limited, however, so please be mindful of others who may be feeling ill and need a more quiet environment for their treatment. Beverages are available at most of our infusion centers and snacks on a limited basis. If you desire a particular food item, you're welcome to bring it from home, keeping in mind that strong food smells may disturb others.
Cancer treatments, such as surgery and radiation, are focused on a certain area of the body where there is cancer. Examples would be the surgical removal of a tumor in the colon or radiation treatment to the lung. Chemotherapy is different in that it circulates throughout your body to target cancer wherever it may be. As mentioned before, chemotherapy disrupts cell division and growth. Because cancer cells generally divide and multiply faster than most normal cells, they are especially vulnerable to chemotherapy. However, there are tissues in the body where it is normal for cells to divide rapidly, such as the cells of the gastrointestinal or digestive system, the reproductive cells, certain blood cells, hair follicle cells. Since chemotherapy cannot differentiate healthy cells from cancer cells, some normal cells may be damaged. It is this damage to normal or healthy tissues which causes most side effects. Side effects from chemotherapy may be short-term, long-term, or permanent. They may occur immediately or at some point in the future. Thankfully, there are many treatments that help prevent, limit, or manage side effects. As we talk about specific side effects, please know that it is unlikely that you will experience all of these side effects. Until you receive chemotherapy, it is impossible to say for sure how it will affect you. Some people undergoing chemotherapy do not experience side effects at all. However, to be truthful, many people receiving chemotherapy experience at least mild side effects in some form. Now let's talk about some specific side effects of chemotherapy. The side effects of chemotherapy treatment can be broken down into 4 general categories. These are effects on the blood, effects on digestion, effects on the skin and hair, and effects on thinking and feeling.
Let's talk about the side effects of chemotherapy on the blood. There are 3 types of blood cells likely to be affected by chemotherapy: white blood cells, red blood cells, and platelets. White blood cells are the infection-fighting cells of your body. When your white blood cells are low, you are more susceptible to getting sick. Having a low white blood cell count is called neutropenia. Typically, white blood cells are at their lowest point 8 to 16 days after chemotherapy treatment. This is when you are most at risk for an infection. However, when your white blood cell counts are low, you may not feel sick or notice any of the usual signs of infection, so it's very important to be watchful. You should take your temperature starting 1 week after your chemotherapy treatment, or anytime you're not feeling well. If you develop a fever of 100.4 or greater that lasts more than 4 hours, or anytime you have a fever of 102 or greater, you should call your oncology provider immediately. If your clinician cannot see you right away, go directly to an emergency room. Upon arrival, let the emergency room staff know that you're receiving chemotherapy, have a fever, and are concerned about a low white blood cell count. Ask to be seated in an area away from others who may be infectious. A lab test must be performed to detect low white blood cells. If you are determined to have low white cells or an infection, it's likely that you will need antibiotics or other supportive therapy. Never try to manage a fever at home when undergoing chemotherapy without first letting your oncology provider know. Red blood cells are the oxygen-carrying cells of your body. When your red cells are low, you can feel very tired. Other symptoms of low red cells are dizziness, headache, rapid heart rate, difficulty staying warm, and difficulty concentrating. Having a low red blood cell count is called anemia. Sometimes anemia is managed with blood transfusions. If you should need a blood transfusion, your oncology provider will discuss this with you. Platelets are blood cell fragments that help control bleeding. They plug small holes in the blood vessels and assist in the clotting process. When your platelets are low, you can bleed and bruise easily. Having a low platelet count is called thrombocytopenia. There are things that you can do to minimize your chances of bleeding and bruising. These can be found in your patient guide. Lab tests will be performed throughout your chemotherapy cycle to monitor your blood cell counts. If at any time you have an abnormal count, you will be informed which cells are involved, if this will affect your chemotherapy cycle, and any special precautions you need to take. Lab tests may need to be repeated to ensure that your counts are returning to normal.
The next system that may be affected by chemotherapy is the digestive system or gastrointestinal tract, starting with the mouth. Mouth sores occur when chemotherapy affects fast-growing, healthy cells in the lining of your mouth. This is called mucositis. Mucositis commonly occurs 3 to 10 days following certain chemotherapy treatments. Mouth sores can interfere with eating and swallowing, speech, and can make you more susceptible to infection. Good mouth care may prevent or reduce the severity of mucositis. Suggestions for maintaining mouth health are listed in your patient guide. Next in the digestive tract is your stomach, so let's talk about nausea and vomiting. Chemotherapy medications vary in their tendency to cause nausea and vomiting. Most people, upon learning that they need to receive chemotherapy, worry that they may get nauseated and/or vomit. It is likely that you will receive medications to lessen or prevent nausea and vomiting prior to receiving your chemotherapy. These anti-nausea medications are highly effective for preventing nausea. Medications given to help control nausea and vomiting are typically given through your IV about 1/2 hour before you receive your chemo, and we call these pre-meds because they're given pre-chemo. Sometimes your oncology provider will prescribe anti-nausea medicine for you to take at home should you develop nausea. If you have been given a prescription, please fill it before you start your chemo. Then, if you become nauseated, you will already have the medicine you need to help you relieve it. In general, we advise you to take your anti-nausea medicine at the first sign of nausea to prevent it from worsening. Nausea is best treated early, so don't try to ride it out. If you feel nauseated, take your medicine. If you cannot take your anti-nausea pills because of vomiting, or you're unable to eat or drink because of uncontrolled nausea, your oncology provider or nurse need to know this. There are many anti-nausea medications, and some are even given in combination. Your medications may need to be adjusted or additional medication added to control your nausea. There are some non-medicinal techniques used to relieve nausea that have been shown to be effective for some people, and these include acupuncture, acupressure, and certain relaxation techniques. The final end of the digestive tract, of course, is involving constipation and diarrhea. People with cancer often experience difficulty passing stools. This is called constipation. Constipation can be caused by the cancer itself, pain medicines, and chemotherapy or lifestyle changes. Constipation can lead to gas, abdominal cramping, fatigue, and loss of appetite. Tips to manage constipation include drinking plenty of water, eating foods that are high in fiber, avoiding low-fiber foods such as cheese, meat, and processed foods, and getting some exercise every day. If these measures are ineffective, your oncology provider may recommend a stool softener, laxative, or fiber supplement. It is not a good idea to use enemas or suppositories unless specifically prescribed. You may be at increased risk for infection or bleeding, so these products are not advised. On the other side of this bowel function coin is diarrhea. Because chemo affects the healthy cells lining the digestive tract, diarrhea may develop. Diarrhea is when your stools are very loose